Good evening, Professor. Hope you are doing well. Today we are going to presenting on cybersecurity and digital health devices and apps. Our group members are Maha, Mustafa, Dhvani, Patel, Dhruvikaben, Korat, and Inderjeet Kaur. This topic focuses on how technology and cybersecurity come together in healthcare. Now we comes to the second slide, which is on introduction. So the digital health means using modern technology in healthcare delivery. Example includes apps, wearable devices, and remote health system that help monitor patients. However, with these benefits comes a big responsibility, like keeping sensitive patient data safe. That's where cybersecurity plays a vital role. As we use more technology in healthcare, both opportunities and risk increase. Now comes to the next part, which is about background and context. So the technology is transforming healthcare every day. From online appointments to remote monitoring, patients can now get care more easily. At the same time, organizations collect more health data than ever before, and this data needs a protection. And digital health is improving patient experience, but also creating new security challenges. So now comes to the next part, which is on technological growth opportunity. So now let's talk about the opportunities. So digital health apps and devices allow remote monitoring, real-time health tracking, and personalized care. They also help hospitals and clinics work more efficiently. For example, wearable heart monitors can alert doctors about abnormal heart activity instantly, and telemedicine apps allow virtual consultants, and AI based systems help detect early health issues. And the rest part will be covered by my another group member, Inderjeet Kaur. Thank you.
Now let's talk about cybersecurity risk challenge. This chart shows the rise in Canadian healthcare data breaches from 2017 to 2023. In 2017, there were only about 20 reported breaches, but the number has steadily increased every year, reaching 35 in 2018, 45 in 2020, and 55 in 2021, and 65 in 2022, and 75 in 2023. This steady rise shows how cybersecurity attacks in healthcare are becoming more frequent and serious. It also reflects how digital systems, apps, and cloud storage have created more entry points for hackers. The main cause include weak security settings, phishing attacks, and outdated software in hospitals. Overall, this upward trend reminds us that healthcare organizations need stronger cybersecurity measures, regular system updates, and better staff training to protect patient information and maintain trust. Moving to the next slide, which is key cybersecurity threats in healthcare. This slide shows the main cybersecurity threats in healthcare. First one is ransomware attacks, which are a big risk, like the WannaCry and Scripps attacks in 2021, which forced hospitals to use paper records. Next one is phishing and insider threats, which can lead to massive data theft, as seen in the Anthem breach in 2015, where 78.8 million records were exposed. Next one is vulnerable IoT devices such as smart pumps can be hacked to change medication doses. There are also cloud strong storage risks where misconfigured systems make patient data public, and weak passwords which allow hackers easy access. These threats highlights why stronger security systems, better training, and regular updates are essential to protect patient information. Thank you, and the next slides will be represented by Dhruvika.
Global healthcare data regulations in digital health. Protecting patient data is essential. Three key laws guides this process: PIPEDA in Canada, HIPAA in the US, and GDPR in Europe. PIPEDA ensures Canadians' personal health information is collected and shared only with the consent and must be kept secure. HIPAA in the US sets strict standards for hospitals and healthcare providers to protect the encrypted medical data. GDPR from the European Union focuses on giving individuals full control over their personal data and requires strong privacy practices. Together, this framework aim to protect confidentially, ensure transparency, and hold organization accountable for any misuse breaches. They form the foundation of trust that allows digital health technologies to grow safely ethically. The next slide is opportunities from addressing security. When cybersecurity in digital health improves, it's create major opportunities across the system. First, it builds patient trust. People are more willing to use the health apps and digital platforms when they know their information is safe. Second, secure systems allow safe data sharing for medical research, which can lead to better treatments and early disease detection. Third, strong security supports innovation in AI and analytics because researchers can analyze large data sets responsibly. Finally, it reduces costs by preventing data breaches, system downtime, and operational infections. In short, investing in cybersecurity doesn't just protect data, it strengthens healthcare performance, innovation, and public confidence. Next slide is going to present Maha.
When we use health apps and devices, we need to think about ethics. It's important to keep patient data private, even while using it to improve care. People should know exactly how their data is being used. This is what we call informed consent. We also need transparency about how apps and devices make decisions with this data. And we must protect vulnerable groups, like kids or older adults, who might be more at risk if their information isn't handled carefully. Looking ahead, there are some exciting ways to make digital health safer. Blockchain could help make data sharing more secure. AI could monitor apps and devices in real time to detect threats. A national framework could help make sure all digital health tools follow the same security rules. And public awareness campaigns will help people learn how to protect their own health data. Digital health devices and apps have huge potential to improve healthcare, but they also come with cybersecurity challenges. We need to make sure these tools are used safely and ethically to keep patient trust. Success will depend on collaboration between healthcare providers, IT experts, and policymakers. Here is the list of our references, and they are supported by reliable sources. To conclude, digital health brings amazing benefits from better access to care to more personalized treatment. But without strong cybersecurity and ethical standards, these benefits can turn into risks. By working together, healthcare professionals, IT experts, and policymakers, we can make digital health safer for everyone. Thank you.